To use an analogy, an individual may have a heart attack. They've recovered from the heart attack, but unfortunately, that heart attack may have permanently damaged the function of their heart. They now have congestive heart failure. By the strictest of definitions, they have recovered from the heart attack, but they have been left with a chronic medical condition that arose from that heart attack. Much is the same for COVID-19. One can leave the hospital and be defined as recovered from the acute, much more to COVID-19 than just the acute infection itself. So we are seeing a great many number of individuals have these prolonged sequelae. How do we define that as recovery? It's a great question that's still unanswered, and it falls into that bucket of things that we're still learning about COVID. Number one, its impact. Number two, how do we define recovery? Who is fully recovered? Are you recovered when you're back and able to go to work? Or did you have to go back to work because you didn't have a choice? You needed to provide it for your family. When we see cases of COVID-19 increase to the extent that we are currently seeing them across the country and even in our region, the best analogy that we can use to describe this and describe the reality that it's not the virus that's behaving differently, it's we individuals who are behaving differently, is to think of quite a dramatic example, but a World War I battle where you have two sides that are entrenched. On one side, you have COVID-19 and it's firing bullets unceasingly towards your trench. If you stay in the trench, you're safe. If a whistle blows and the troops climb over the wall to charge into no man's land, they are going to get hit. That's essentially what is happening when we see these increased case numbers. We're climbing over the wall, we're entering no man's land, which is basically lack of protection from a mask, and we're getting hit.